everyone, good to see you again. In this video we are going to describe blood flow through the vascular system, which is a continuation of our study of hemodynamics. In our study of the heart, we learned that pressure forces blood from the ventricles into the largest arteries of the body, the pulmonary trunk and the aorta. And the pressure needed to drive the blood into the aorta is much higher than the pressure needed to drive the blood into the pulmonary trunk. And the reason being is that the blood entering the systemic circulation has much farther to travel than the blood entering the pulmonary circulation. As a matter of fact, if the right ventricle were to pump with the same amount of force behind it as the left ventricle, the fragile pulmonary capillaries would burst. And so the pulmonary system is a low pressure system. Typical systolic pressure in the pulmonary trunk would be around 24 millimeters of mercury, and diastolic pressure would be around 10 millimeters of mercury, whereas in the aorta, systolic would be 120 and diastolic would be 80. And we know that stroke volume is the same for each side, and it has to be. Otherwise, there would begin to be a backup somewhere in the system. And where that backup is, fluid would begin to leak out of the system. And this was mentioned at the end of the heart lecture in relationship to congestive heart failure. So let's take a journey through the vascular system to understand the various influences on blood flow. Whoa, I feel like I'm on the Body Wars ride at Disney. Let's focus on the systemic system because that tends to be the one we focus on more clinically. To understand fluid flow and their various influences, we need to return back to two basic concepts in physiology, and those are pressure gradients and concentration gradients. Concentration gradients will come into play more when we study what is happening at the tissue level. So let's focus on pressure gradients for now. Let's simplify this concept. For blood to make the trip through the entire circuit from the heart and back to the heart, the pressure at the end of the trip must be less than the pressure before it. Make sense? And that's what this picture from your textbook shows us. We're going to focus on mean arterial pressure, or MAP, which you will learn about in lecture. And we see that MAP is approximately 93 millimeters of mercury at the beginning of the trip and drops down to about 35 millimeters of mercury at the beginning of the capillary beds. So at the smallest arterioles, the change in pressure in the system is about 60 millimeters of mercury, or we could say the gradient is 60 millimeters of mercury. If there were no other forces acting on the blood, then this gradient would drive the blood at a certain rate. And when we talk about blood flow, we measure flow by volume over time. If we were referring to the entire cardiovascular system, then flow would equal cardiac output. If we were talking about a particular tissue or organ, then we would refer to perfusion rates. Getting back to our graph now, at the venial end of the capillary bed, the pressure drops to about 17 millimeters of mercury and continues to drop, and at the distal end of the vena cava is about 2 millimeters of mercury. And by the time the blood gets to the right atrium, the pressure is down to 0. So the pressure gradient at the venous system is about 15 millimeters of mercury. It would seem that with venous pressure being so low that it would be impossible to return blood to the heart, especially when it's working against gravity. Well, that's where the body has so brilliantly designed 4 important mechanisms for venous return that we'll talk about in class. What I want to focus on now is how the various kinds of vessels influence blood flow. And then I want to talk about the factors that work against the free flow of blood. In lab, we'll be looking at arteries, veins, and capillaries under the microscope, and we'll also be talking about the 3 layers that are found in the walls of arteries and veins. If you haven't already looked at this information, please take some time and look at it now before we go further with this video. The largest arteries of the body are called the elastic arteries because of the large amount of elastin in their walls, especially the tunica media. During ventricular contraction, these elastic arteries expand a bit, absorbing some of the pressure, storing that energy, and then during ventricular relaxation, they recoil, maintaining or restoring that pressure, continuing to move the blood when the ventricles are relaxed. If the walls of these arteries became rigid and they lost their ability to smooth out the pressure, this would cause high blood pressure, which the heart would have to overcome. Branching off of the elastic arteries are smaller arteries called muscular arteries. These arteries have the largest tunica media, which is a smooth muscle layer. This layer controls the diameter of these vessels, and these vessels are able to vasoconstrict or dilate, affecting blood flow. The smallest arteries are the arterioles. Arterioles also have smooth muscle in their wall, and it is these vessels that will direct blood to a particular tissue or shunt it away. Along with small muscular arteries, these are the vessels that form the major part of what is known as peripheral resistance. The smallest vessels are the capillaries. Capillaries are missing the outer and middle layers. These are the sites where exchange occurs with the tissues. Therefore, capillaries must allow the movement of fluids and solutes through their walls. Postcapillary are the venules, and these are quite porous, and this is very important, which we'll study when we study capillary exchange. And then beyond the venules are the veins. And the most distinguishing feature of the veins are the valves that prevent backflow of blood. The largest veins do not have valves, but they do have a longitudinal band of smooth muscle in their wall. Veins have the largest lumens, therefore they are the blood reservoirs. They can hold up to 65% of the total blood volume. Arteries and deep veins tend to travel together as companion vessels, and it is very easy to do a side-by-side comparison of them, and this we'll do in lab. It's good to understand the structural differences between an artery and its companion vein so that you can easily identify them. Also notice the nerve traveling along with these vessels. This triad is a common grouping that travel together, and the group is called a neurovascular bundle. Let's get back to our discussion of hemodynamics and the factors that affect blood flow. We spent quite a bit of time discussing pressure gradients, and hopefully it makes sense to you that fluid will flow from a place of high pressure to a place of lower pressure. Let's take a look at this equation, which is a basic equation for fluid flow. Please don't let these equations intimidate you. Once you know what each symbol represents, it's easy to understand their relationships to each other. We know that F is the rate of blood flow in milliliters per minute. Delta P is the pressure gradient from beginning point to end point. And R is any factor that causes resistance to the blood flow. Looking at this equation, we can see that there is a direct relationship between flow and the pressure gradient. So as the pressure gradient goes higher, flow increases. Whereas flow's relationship to resistance is indirect, meaning that if resistance increases, this will decrease flow. Let's now talk about the three main causes of resistance, and hopefully these will make sense to you. The first factor is viscosity. Viscosity refers to the thickness of blood. The thicker the blood, the slower. And the thickness of blood is related to the numbers of blood cells and the amount of protein in the blood. The next factor is the length of a blood vessel. The longer a blood vessel, the slower the overall blood flow rate will be. And the last factor is the diameter or radius of a blood vessel. And the smaller the radius of a blood vessel, the slower the blood will move. Let's take a look at how blood moves through a vessel to better understand how length and radius affect blood flow. Fluids that are bound by some kind of wall or container will tend to flow more freely the further away from the wall that the fluid is. So within a blood vessel, the blood within the center of the lumen is flowing faster, and that is because the effect of friction dragging the fluid that hits against the walls. With a larger lumen, there's more room for the blood to move unobstructed by friction. And so vessels with a large diameter will tend to have greater blood flow rates. This relationship, however, is not linear. Small changes in diameter of a blood vessel will make very large changes in blood flow. If we were to compare two blood vessels of the same diameter but of different lengths, The blood within the longer vessel would be exposed to more of the friction forces over its entire length, decreasing the overall rate of movement. So let's put all of these factors into one equation and then plug that one into the original. Resistance is equal to A times the length times the viscosity divided by pi times the radius to the fourth power. Now let's plug our equation for resistance into the original equation. And since we don't want a fraction within a fraction, let's rearrange this equation. And what we end up with is an equation for blood flow that takes all of the factors into consideration and shows their relationships to flow. We'll talk a bit more about these factors in class, especially vessel diameter. So expect to have that conversation, and I'll see you then.